lack of knowledge around periods, both, in menstruating individuals and in doctors. Unfortunately, it's not something that we talk about in great detail in medical school. And if you don't go to OB-GYN residency, you may not talk about it or think about it for a very long period of time. And so we just kind of forget what it's like to have miserable periods, or what sort of defines heavy periods, what's normal, what we can do about them. There's all this information that is accessible but not necessarily uppermost on everybody's mind. And so just this idea of, patients would come into my clinic and they would say, they have iron deficiency, or I'm working them up for a bleeding disorder, and I ask them about their periods, and they're reporting these terrible periods to me, and then just not knowing that it's abnormal, or no doctor had asked them about it before because they didn't think to ask about it. And so I think just kind of a growing awareness about how little we talk about this subject and how much it impacts the lives of my patients were really kind of what spurred me to start trying to do some more education. And I had really started in the doctor's space, so a lot of continuing medical education and grand rounds and things like that, talking about periods. But that only gets you so far. And so I'm really fortunate that Mary Beth Griffin, my kind of co-conspirator in Dr. Period Hackers, has all this wonderful public health knowledge, and really kind of working together to try to get both sides, the patient side and the clinician side, getting that education out there. I'll have a patient come in and she'll say, oh yeah, my periods are normal. I wear the ultra tampon and an overnight pad and I change them every 45 minutes or so. That is not normal. That is way too much. We need to rein that in and improve quality of life and decrease blood loss and all of that. So I hear people thinking it's normal when it's not. I hear, patients telling me how it interferes with their quality of life, right? I'll have patients who, they have to have a not only a pad or tampon with them at all times, but backup clothing in case they bleed through, because that's a normal occurrence for them. I hear lots of patients saying that their doctors had never asked them about their periods before. Nobody had ever taught them what a normal period was before. Unfortunately, sometimes that their doctors hadn't listened to them before when they reported symptoms. Those are kind of the most common ones I see, and occasionally we'll have again, on the other side of the lack of knowledge, somebody will come in and be really worried that their periods are too heavy, when actually it's sort of what we would call a normal period, which doesn't mean that there's not things that we can and should do about it. Certainly there is, but that undue anxiety is another concern with the lack of information that comes up in my clinic. I wish doctors felt more comfortable talking to patients about their periods. I think there's a lot of concern that it'll be awkward for the patient, and not an inconsiderable amount of concern that will be awkward for the doctor as well. But in my experience, and maybe it may just be easier for women to talk to me because I'm a woman, and I am in a women's clinic, and so maybe it's a little bit more expected. But patients have been really forthcoming with me about their symptoms, and that's really been important and helpful to me. So maybe that they knew it doesn't have to be awkward, that patients want to talk about it, that they need to talk about it. I think most doctors know that heavy menstrual bleeding is common in bleeding disorders. I do think that historically bleeding disorder care has been sort of centered on a population that doesn't menstruate, because hemophilia has been kind of the main diagnosis driving a lot of our bleeding disorder centers, and that was traditionally thought to be a man's disease. That's obviously not correct, but it is diagnosed more often in men, let's put it that way. So yeah, I think just kind of an awareness of how frequent heavy menstrual bleeding is in patients with bleeding disorders, what we can do about it, and just comfort talking about it, I think are the main things. The ones that we talk about are, how frequently are you changing protection, right? So are you changing your pad or tampon? Technically more often than every hour. But in my clinic, I say anything more often than every 2 hours, we should probably start to do something about, particularly with patients being able to use these, overnight pads or these ultra tampons, things like that. If patients are having to wake up at night to change their protection or bleeding onto their sheets, if they know they have iron deficiency or a history of iron deficiency, passing clots larger than a size of a quarter is another one. Those are all common symptoms of heavy menstrual bleeding that you can be on the lookout for. And also, a common complication of heavy menstrual bleeding is iron deficiency. And so iron deficiency with or without anemia, and that can manifest in a number of ways. So fatigue is the most common symptom, decreased exercise tolerance, sometimes muscle aches, leg aches, kind of restless leg type symptoms. Some patients report difficulty focusing, kind of a brain fog. Those are symptoms of the iron deficiency side of things. I think it's also important to know that heavy menstrual bleeding is it affects up to a third of menstruating individuals, and only about 20%, and that's a conservative estimate, it may even be less, 20% will actually have a bleeding disorder associated with it. So it's not just patients with bleeding disorders that are at risk of heavy menstrual bleeding, and not all patients who have heavy menstrual bleeding will have an underlying bleeding disorder, but that's what it's important to get into the clinic and talk to your doctor about. And really what we focus on is looking for other symptoms of bleeding, what I call heavy menstrual bleeding plus. So if you have heavy menstrual bleeding plus nosebleeds, or plus bleeding after surgery, or plus prolonged bleeding after cuts, those are kind of the things that make me really prompt me to do a workup for a bleeding disorder. Commonly think about period poverty is a lack of access to basically menstrual hygiene products. So the pads and tampons needed to sort of get through the day and normally function in society. And that certainly is a big problem. It doesn't happen as much necessarily in my population for whatever reason. I know that my colleagues have encountered girls who have trouble getting enough menstrual products to go to school. They'll actually have to stay home from school because they don't have menstrual products. And it's definitely an issue throughout the country and obviously throughout the world. And on Dr. Period Hackers, we talk about different aspects of period poverty and the tampon tax and the pink tax and things like that, that all kind of play together. But another aspect of period poverty that I don't think we talk about nearly enough is its lack of access to education, which I think we tend to think happens, maybe outside of the US, maybe somewhere in the developing world where girls don't have as much access to education and schools and things like that. And maybe there are cultural taboos, but it is a very real thing right here in our neighborhoods, in the state of Oregon, in the US, all over the world, because again, this lack of talking about things. So, I would argue if a menstruating patient is having heavy menstrual bleeding, she doesn't know that it's heavy bleeding because she wasn't provided with that education, that's its own form of period poverty. And so if you define it by that, I would say it affects the vast majority of menstruating individuals around the world. Certainly the aspect of not having enough products is going to be a bigger deal for patients with bleeding disorders who are having heavy menstrual bleeding. But it's a big problem. I guess I would just encourage, all patients with periods to feel comfortable talking about them. It is a totally normal body function. It affects half of the population for 30 or 40 years of life. It's not something that we should be ashamed about. It's not something that we should feel uncomfortable about. It's certainly not something you should have any hesitation talking to your doctor about. And if your doctor's not comfortable talking about it, then you can talk to another doctor or get a referral to a gynecologist. There's lots of options, but feel comfortable talking about it. Pay attention to, your body. If you notice that your periods are getting heavier or they're more irregular, things like that, it's good to be aware of that. So again, you can talk to your doctor about it. Yeah, I think that's the big thing. Just to be comfortable talking about these things and to arm yourself with knowledge. And we try really hard on Dr. Period Hackers to, talk about what is a normal period? What are ways to control periods? What effects can we expect on periods from birth control and things like that? So hopefully that's a useful resource for folks.